I know Erin and Kathryn because we worked on this, but they will talk about that. Giada has sent her apologies today. Oh gosh, I've got transcript coming up. Just give me a second. Giada has sent her apologies today, but Giada is also part of this group. Erin and Kathryn are going to talk to us about riding the wave of collaborating on systematic review support in healthcare and beyond. And I'm going to send it across to them. If you've got any questions, I will be monitoring the chat, but there is a Q&A also on your top bar. If you're not used to using Teams, at the top you'll see a Q&A. If you've got any questions, I will keep an eye on that one as well. But you can put them in the chat. It would be easier if they were in just one place. So Q&A is my preference, but I will try and keep an eye on the chat at the same time. I think Sophie, my colleague, is also in the room on the call, who will also, any kind of technical difficulties or anything will help us along. So over to Kathryn and Erin.
Thank you very much, Louise. A very, very, very warm welcome to everyone, and thank you so much for joining us today. Just two tiny housekeeping points for those who are joining us live. We are sharing the slides using PowerPoint Live today, so if you've not used this before, there is a 3-dot menu under your slides that will allow you to control your personal zoom, contrast, and access some translation options if those are helpful for you. You'll also be able to flick forward and back independently through the slides, so if we move on too fast and you want to have a look at something, you can pop backwards for a second without disrupting the flow of anything. But that being said, as technology is, as it behaves, if it goes a bit awry, just let us know and we can swap and do these the old-fashioned way. So Louise has already given us a lovely introduction, but my name is Erin Bloxsidge, and I am the faculty librarian for Health and Medical Sciences at the University of Surrey. And I will just allow my co-conspirator today to introduce herself.
Hi everybody, and I'm Kathryn Devine from the University of Worcester. I'm one of the academic liaison librarians, primarily supporting psychology and sport and exercise science.
And as Louise mentioned, we would be remiss if we didn't highlight colleagues who have been instrumental in the creation of the community of practice that we're going to talk about today, but who aren't able to present with us. Our colleague Giada Zanella, who's based at Aston University, and then our chair Louise Speakman, who was the initial spark that brought us all together. But you'll hear a little bit more about that in a second. So in that, I will move forward and just give you a little overview of what we're going to touch on today. We have called this presentation Riding the Wave, Collaborating on Systematic Review Support in Healthcare and Beyond. And I'll admit that this title is a bit of a riff on an exchange of experience panel session that the four of us gave last year at the University Health and Medical Libraries Group Summer Conference. But today we're taking a slightly different approach, and we'd like to give a more in-depth look at the creation and the mechanics of the community of practice and the experiences of the members in our community. We really hope to inspire you to come join us and contribute to the conversations, as we're very much a user-driven community and we want to help collectively build the things that we wish already existed. So we will touch on how the community of practice came about and how we made our choice for the platform that we've ended up in, Discord, which you'll hear a little bit more about later. We will be looking at functionally how the community of practice works on this platform, as well as the types of discussions and resources that you'll find there. And we also wanted to touch on the feedback that we've had in the community of practice over the last year and how we are trying to evolve to meet the needs of our community. But before we kind of dive into that origin story, I guess, I just wanted to give you a little bit of background, because you might be asking, who are we and why are we the ones who are presenting on this? So all four of us are librarians in higher education. We're based at universities in England, and we've all been in roles that involve supporting students and researchers where we have seen a marked increase in the demand for supporting systematic reviews at all levels. As you'll have heard from both Kathryn and I, we support a range of disciplines across the four of us. So it covers quite a standard biomedical remit, as well as some extra disciplines. But all of us came into our roles without having formal training in systematic review methodology. And what I mean by that is that none of us have masters in evidence synthesis or kind of extensive deep background knowledge prior to entering the roles that we were in. The kind of origin story that we'd like to talk to you about. So it was a very balmy day in June in 2023, and as it's England, it may not have actually been balmy, but I like to paint a very nice picture. So Dr. Michelle Madden was where we are now, delivering a really excellent session in this series on common searching errors in student systematic review dissertations, and it was fantastic. So if you haven't seen it, go back to the YouTube channel that Louise put in the chat and watch, because it's brilliant. But on that day, the chat was incredibly active, and it was really engaging and positive to see loads of people confirming that they were having the same experiences and the same challenges. And Kathryn, Giada, Louise, and I were all messaging in the chat to say that we really wanted to have a place where we could have conversations about some of the things that Dr. Madden was discussing in a beginner-friendly way that was beyond the kind of limited window of a webinar chat. So Louise contacted us the next day to ask if we wanted to look at forming some kind of working group based around our ideas. And I should say that the rest is history, but that would make for a very short presentation. So we did spend the next 6 months regularly meeting to work out what it was that we wanted to create and how that might be different from things that we saw that already existed and would meet a need that we felt that we saw. There were several existing JISC mail lists that were fantastic, and some excellent self-study resources that had been produced by librarians for librarians globally. And there were also training programs that we saw pop up from individual experts in the area, as well as organizations like Sheffield, Cochrane, Medical Library Association. And some of us had used a few of these options, but we did feel that there was a missing component and a need that we wanted to meet beyond those existing formats. So after testing and testing again and testing a third time, we did settle on a structure and a platform, and we launched on the 18th of January in 2024. This was on the tail end of another Systematic Review Conversations webinar by Maria King, who discussed working on reviews with academics and researchers as an information specialist. Also excellent. It's in the YouTube channel if you haven't seen it. But we really wanted to think about how we could build community and help create something that we felt that we really needed for ourselves and that we thought would benefit others. So in terms of the kind of goals that we had around community building, we had many conversations about how learning in public can feel a bit intimidating, and we really wanted a space that took that anxiety out of the picture and allowed for a more or peer-to-peer learning and an informal, relaxed environment. And it was really clear from our conversations and other chats during other Systematic Review Conversations webinars that many people were feeling very much the only person in their department or at their institutions doing this kind of work, and that the water cooler style of chat and the ability to bounce ideas off other people informally just wasn't as accessible for them. So we did want to kind of center a commitment to creating a space that would share practice and knowledge and expertise and help build colleagues' skills and confidence around systematic reviews. And I should say at this stage, how we define support is very much in the context of the community of practice is quite broad. This could be teaching or advising students or staff, embedding into research teams, working in hospitals, delivering content in the private sector. So we don't really limit the definition of support to mean one thing, even though we do come from a very specific background that informs the work that we do. So when we were looking at kind of setting that goal for ourselves and trying to align with that overall thought, it was very much we wanted non-judgmental. We wanted everybody to be able to come and ask any question, no matter how beginner they felt it was. And we wanted it to be very much a learning pool, so that peer-to-peer learning was the core focus and that we were sharing experiences and resources that had helped us. And we did want it to be inclusive for all disciplines and sectors, because we saw a demand that was rising both within our disciplines as well as for colleagues in other areas who hadn't necessarily used the kind of methods that are involved in systematic review support. So thinking about where we have set things up, and just to give you a little bit of a background about why we've chosen what some people might feel is a slightly odd choice to set up shop. So I'd like to give you an introduction to Discord, which is where we've ended up. But for those of you who haven't heard of it before, I'll cover all of the basics, but I'd be really curious if you can give me a little thumbs up reaction emoji or a thumbs up in the chat, just so I can get a sense if anyone has actually used Discord before. Because I know that I was brand new to Discord when we were discussing this. Okay, more people pinging through that have used Discord than I was expecting. That's actually quite surprising. So you'll get your nice background canned history of Discord if you don't know. But what Discord is Discord launched in 2015, and it is a social platform that allows for text and media-based instant messages, private messaging, as well as audio and video chatting. And it's made up of what we would call individual communities that are focused on a topic or a group, or maybe a business has set one up, and they can be public and visible and searchable, or they can be private. And regardless as to how they're set up, they're called servers. So if I use the words Discord or server or community of practice interchangeably over the next couple of minutes, what I'm referring to is our home on our Discord server, effectively. You can use this tool in a web browser, so you can open it just like a web page, but there are also dedicated apps for pretty much all of the smartphone operating systems and all of your kind of desktop operating systems. So you can get it on Windows and in Mac environments and possibly Linux as well. Originally, this was really popular with people who were involved in online gaming, and you could join a server and play together with friends and use the video and audio chat components or use the text channels outside of active games. But you might find actually that a lot of university clubs and organizations and businesses now use Discord to kind of organize and interact with their communities instead of things like WhatsApp or other tools, because it removes the limits on the number of members that can join, and it allows people to connect without having to give out their personal phone numbers, and you can kind of organize conversations in an easier way. So when we were thinking about how we wanted to create the community of practice, and we investigated a lot of different platforms and different modes of creating community, we absolutely looked at Teams, because a lot of us use Teams in our work environments. We looked at Slack and a few other options that we'd seen. But in the end, Discord won out. And it was very much because at that time it felt like a Teams channel structure. So it would be familiar to what many institutions were using coming out of hybrid working or working from home in the pandemic. So lots of people would have had some level of exposure to being able to communicate with colleagues in this way. But we really wanted something that was independent of our respective institutions, that would be future-proofed from people changing jobs or roles or moving between sectors. So we wanted something that we knew would have that longevity, hopefully. We hope Discord will be around for a very long time. What was very attractive to us, and we'll touch on a little bit later, is that there's the option to host live events and video and audio chats automatically built in. So it was something that we saw we might be able to use in future to enhance the kind of activities that we were doing in the community. We also really were pleased that people could choose to be their professional selves and come in and create a professional identity, or they could choose to be anonymous. So there was the option for people to choose how much of their kind of personal or professional lives they wanted to bring into the community of practice. So with that in mind, and kind of that sense of background, let's just have a quick look at the actual server and what it looks like if you join and are collaborating with us on different topics. So if you join, this is exactly where you will land when you launch into the Discord server and are on arrival. You should ideally receive a welcome message from one of the admins just to acknowledge that you've joined. The structure, we hope, will feel similar to Teams. So you have conversations that are organized by topic on the left-hand side, and you see we've got a range of things, including artificial intelligence, database questions. I can tell you there are a lot of chats about EBSCO happening in there in the moment. Search strategy design, we've got an area just to dump links to useful resources that people have found helpful. And we've also got software and systematic review management that covers a whole range of different things people might be using, and beyond health systematic reviews topic area. And these are very much informed by what people are wanting to discuss and are growing as we kind of organize things. So outside of the text channels on the side, you will see that you have a kind of central thread of conversation. You have a text box at the bottom that you can use to reply to people. You can tag people if you want them to make sure that you've seen the message. You can use emojis and GIFs and add links to your messages. So you can do all the things that effectively you can do in Teams if you're used to doing those at your own institutions. You will notice up in the upper right-hand corner that there's a little push pin thumbtack, and that's where the admins have pinned messages just to have a look at when you come into a channel. So often we'll have calls for feedback, or we'll have crucial posts that we want to make sure that people see that don't get lost in the flow of the conversation. So it's always worth looking at those if you are hopping into a new channel and are interested in kind of getting a sense of what kind of conversations are happening. You will notice down at the bottom that near where my profile is, there's a voice channel section. So sometimes you will see that people will have joined the voice channel. We don't have a lot of activity in there yet, but we may be able to make use of that in the future if people want to have different kinds of conversations. So the bulk of the activity you'll find in the text channels if you join the server. We would very much encourage you to introduce yourself if you do join. We have a specific channel just for that because it really helps people identify others in the community who might be supporting niche disciplines or working in different types of roles. So you can kind of get a sense of who you're talking to and where they're from in an immediate way. You also have the option to edit your own profile to be as professional or as informal as you like. One thing I'll note that isn't pictured on this image is normally if you're on a laptop size screen, there's a column on the right-hand side that would show you people who are actively signed into Discord, whether that's the app on their phone or on the web. And you can choose to set yourself as invisible, so you don't have to announce your presence. You can control how visible you are in the Discord platform. One thing that people often ask about is I've got another place to check things and another place that sends notifications, but you can control notifications to suit your preferences. We know that notifications can be the death of concentration and focus. So you can switch everything off and just pop into the server to search for a topic if you've got questions and you want to see what kind of conversations are happening. And you can do that when it suits you, or you can choose to be notified when different conversations happen in specific channels. So you've got a lot of customizations so that you don't just have one extra thing that's pinging you asking for your attention. So now that we've had a brief look at the server, if I were you, I'd likely be wondering who's actually in the room. Who is it that I'm actually talking to? Who makes up the community of practice? And what I will say is we are multi-sector, so we have people who work in both public and private academic environments, clinical research environments, private businesses, consultancy firms. So there's a lot of range of people who are in sort of different avenues and different perspectives. When we started the Discord last year, we had 120 members join in the first month in 2024. And as of last count this week, we are up to 261 members, a little over a year on. And we obviously want to encourage that number to grow just so we can get more perspectives and more people feeding in and contributing to conversations. We are international in scope. So we do have people who work in the UK, so Wales, Scotland, and England, and we've got some folks who are based in Ireland, but we've also got folks as far-flung as Brazil. We've got the US represented, Australia represented, and a few folks from France and from Sweden in the Discord. So we do have a nice kind of coverage of international areas, and it's quite nice to see how things are done differently in different places. In terms of disciplines, I appreciate that not everyone will be outside of health and medicine. So naturally, because of the way that systematic review methodologies have come about, we have lots of people who work with biomedical or health or allied health related faculties or information, but we do have a nice range of folks who've joined particularly recently who cover other areas. So we've got folks who represent engineering and computing, education, social work, some business and management folks, as well as social policy, sport. I was very excited to see some colleagues from biological and marine sciences join, as well as geography and environmental sciences. And we also have a few folks who have economics and political science under their remit. And that's just to say that It's really fascinating to watch how this particular way of searching and these particular methods are really expanding into other areas outside of biomedical sciences. And people are then having to try and work out the best ways to turn things that are aimed at a very particular discipline and make them work and make them reproducible and transparent in those other areas. So in terms of the kinds of roles that people have disclosed that they are involved in the server, we have a good chunk of UK university librarians, as we've been born in the UK. We have NHS and hospital librarians who work in a more clinical setting. We do have some information specialists who work in research centers or research teams. So we've got some folks who are more embedded in that research culture side of things. I've spotted a couple library and information science lecturers who've identified themselves in the server, which is really nice to see that that might be folded into curriculum in certain places. And we do have some colleagues from the private sector. So there is a really nice blend of people who are contributing to conversations. And it's quite interesting to see the different perspectives, the different tools that people have access to, and just such a wide range of different perspectives represented, which we feel is a real strong benefit of this particular community. So now what I'm going to do is I'm just going to hand over to Kathryn, who is going to walk us through what's been happening in the server over the last year.
Thank you, Erin. Thanks, everybody. That was amazing. I'm going to follow that now. So, yeah, we've got lots of lively conversations going on, and I've put a few examples actually in the slides here. Just some of the things that are being chatted about. People asking about software that they might be using, discussing tools for analysing literature, people having problems with their search strategy, database queries, all kinds of, there's so much going on in the server all the time. So there's just a bit of a flavour in there of some of the things that are going on. And I think, as Erin has kind of said already, we're just really, really keen to encourage people to ask the questions, whatever they are, no matter how simple they might seem. I was messing about with something on EBSCO, couldn't get my searches to combine as they should, and I was like, I just don't know what I'm doing here. And eventually I sort of plucked up the courage and went, I'm telling everyone to put this stuff in the server, it's about time I did the same. And I went and put my question in, and it was the smallest thing that I wasn't doing that I should have been doing, and it just solved all my problems. I've been sat there for ages worrying about it, and someone came along and solved it for me in about 30 seconds. And I think that's what we want to encourage, is that don't feel, you want that fresh pair of eyes on something, you want to ask that question that seems like it might be too simple, you don't want to fire it out to an email list and you don't really know who's reading it. That's what we want, and that's what we're seeing. And it's that very real-time feeling of interaction that gives it that liveliness that we really like. So there's another screenshot there just showing one of those conversations between myself and Erin, so we haven't had to black out too much of the names, just to show what we're sort of doing in terms of how those conversations work in the different channels that we have as well. So obviously Erin's talked quite a lot about what we've already got, how we're already using it, how it came to be, but we're not going to stop there. We're always seeking feedback on what we're doing and how we can improve the experience for all our community and our users. So we have a pinned Padlet on the server to collect feedback, and we actually do, that's always there, so people can always put that feedback on, but periodically we make a bit of a push to ask people for their feedback. We added the Beyond Health systematic review topics channel off the back of the feedback that we received, one of our initial kind of pushes for what would people like. And we've tried to restructure the server a little bit in terms of, we've got like an Ask the Admins channel to make it really clear that there's some way that you can go specifically if you've got an admin related question, not sure what channel to post in, you want to ask a question about the mechanics of Discord, that's where you can do that. And we've got an announcements channel as well now that is restricted to just the admins posting in it, to make sure that it doesn't get lost in lots of replies, so people can acknowledge it, but they can't actually post anything in there. So as we've grown to know Discord better and its capabilities better, we've been able to make those changes. And as Erin alluded to at the beginning, it was one of the reasons for choosing the platform in the first place, was the capabilities of that platform and the way that we could future-proof and hopefully build on what we're doing as well. Beyond Health SR Topics channel has proved very popular. As we've said, we're seeing a lot more inquiries from members who are outside what we might describe as the traditional area for systematic reviews to be conducted. So things like business and sport and education. We're seeing a lot, I think it's grown as well since the pandemic, when students perhaps couldn't go out and collect primary data. And I think a lot of that has stuck in terms of how dissertation modules, certainly at Worcester, I mean, I can't speak for everywhere else, but certainly how dissertation modules at Worcester have been set up, that students are doing systematic type projects as opposed to collecting a lot of their own primary data. So in terms of the impact of the community, this is some of the feedback that we've actually received on the Padlet. So when we've asked people kind of what they're enjoying about it, we've got lots of things around the idea of the diverse range of participants that we've got. So having a really wide-ranging group of people that you're interacting with, knowing that there are other people there in the same boat as you. I think that's the problem shared is a problem halved thing is really strong theme that comes through, is thank goodness I'm not the only one feeling like this, which because it can be isolating if you're really the only person in your team that deals with much of this stuff, knowing that there's other people out there in a similar boat to you, hearing other people's experiences, how they do the tools, how they use the tools, but in an informal way. So not necessarily going to a training session on something, but hearing a little bit about something that perhaps you already know a bit about, but seeing someone else's way of using that. Obviously applying what you learn to your own practice. So people finding that things they were planning on creating from scratch are actually already in existence, and being able to borrow, adapt, adopt other people's materials, and people very, very kind about sharing a lot of that in the Discord. Obviously it's entirely your choice whether you share things or not and how you ask people to use them. But people are generally very generous, and it's lovely to see that sharing going on. People helping each other to refine search strategies, kind of sense check things that they've done. Why isn't this working as I expected it to? And lots of resource sharing, and all, you know, sitting in the channel, waiting for people to be able to go and pick them up if they, as and when they need them. And just a really strong sense of people's comfort in interacting on the platform. You can see the previous responses. You can it's clear that these questions are safe to ask, and that you feel that you've not sort of got a gatekeeper in front of you, or that you're sending things out into a void and you don't really know who's reading it. And you can see that history, you know, lots, and not getting lots of email responses. So I mean, email chains and lists are brilliant, but obviously you will see lots of email responses, and maybe you just want to dip back into the server as and when suits you. And I think that Discord very much allows that, because you can control how many notifications you're getting. You're not being bombarded by information when you're not really interested. You're no longer interested in a thread. You don't have to keep, you know, interacting with it if you don't want to. So we've got a fantastic quotation here from Cheryl Francis at the University of Sunderland. This is actually something that came to Erin following an event that she and Giada were at together. So Discord, self-taught systematic reviews, community practice has been an invaluable asset to my learning in conducting SRs. It feels like a safe place to ask odd questions. I mean, that could be our strap line. I think we might have to adopt that as literally our kind of you know, motto. We'll try and perhaps translate it into Latin. If anyone can translate it into Latin, that would be amazing. So a safe place to ask odd questions, oddities that aren't covered in the books. So these little bits and pieces that you don't read about in the books. In the books, it all goes perfectly, doesn't it? Of course, in reality, not at all. Has seasoned systematic review researchers who are willing to help and guide people, but there's also, of course, the people who need the guidance or feel new to the whole thing. So it helped Cheryl so much that she introduced it as a key tool for searching in her talk at the Core Information Retrieval Forum. That's the summary really of that quotation. So we are going to have that framed, I think, in gold and put on each of our office walls. I think it's a fantastic, you know, fantastic view of the server, and exactly really what we hoped it would be when we set out. So what do we do next? Well, we think the sky's the limit, really, because we think overarchingly, whatever our members would like, if we can provide it, we will endeavour to do so. So what we've currently got going on is thinking about resource gathering, so creating some open Zotero groups for kind of crowdsourcing of resources. First of one, we've got one on SR, Beyond Health SR topics, and that's about to launch very soon, probably today, I suspect. And considering how we might use a Discord platform for offering live events as well, because it was initially one of the things that did attract us, apart from the fact it's not institutionally linked and all the other things that Erin talked about, was definitely the sort of capabilities it's got going forward to do bigger and greater things. So we just really encourage you to join us, and let us know what it is that you want from the community. It's not our community, it's your community, and we're here really to facilitate it. So that said, here is our plug for joining us. I have put a QR code here. We've got the tiny URL as well. If anyone tries to join, and the links are not supposed to expire. That's the only thing I will say about Discord, is that although you can set up an invite link to not expire, it seems to expire anyway for reasons that we have not fathomed. So do not be put off. If anything's not working, please get in touch with Louise or with me, or Erin. We will make sure that you get into the server. I can actually hear my Discord server pinging as I'm talking, so I believe people are joining. And of course, I can't go and look, although I'm desperate to, because I'm sure this is people in this room joining right now, which is amazing. I hope it is, and welcome to all of you if you're joining right now. So that is everything from me. I will leave the next slide, just says any questions, but I will leave the joining slide up instead rather than flicking to the question slide. So thank you everyone for listening.
Thank you both. There is actually a Latin translation now in the chat, Kathryn.
Absolutely brilliant. Love
this
that.
is why I love being a librarian, and why I love all other librarians that I've ever met.
It needs to be pinned now across Discord, and then obviously with the translation underneath. Thank you very much for that. Even some of it, even though I'm part of it, I was like, oh yeah, I remember that now, because some things you do forget, don't you? There's a lot of weather chat going on that I missed right at the beginning when we were talking about the weather. So there's a lot of cold places going on as well. So I want to say welcome to our international colleagues that are on the call. I think they're in -17 at the moment, which is a bit chilly. What I will say as well, Kathryn's just mentioned the notifications. The last time we all met as a 4, which is only, I don't know, maybe a week ago or so, maybe a bit longer, I was like, Discord's a bit quiet lately. And they're at it, no, it's not. I'm at it, well, I've had no notifications. And I'd actually turned them off. so they're at it, no, it's really pinging. And I was like, is it? Because it's very quiet. So anyway, I'd done something and turned all the notifications off, so I hadn't seen them. I put a couple of questions in the Q&A, but I'm going to see if anyone else has put anything in. I'm not going to name names because I want to try and maintain a bit of confidentiality in the YouTube recording. But I will say, shared in the chat is Cochrane interactive training. So if anyone's not got any kind of formal training, there's a link in there, and I will send that link out when I send the email out later. Okay, so we've got a chat. Is it only librarians and information specialists who use COP, or do researcher students who want to learn more about use systematic review methodology use it as well?
It's mostly information professionals, and we don't actively promote it to researchers and academic staff, but we have got 1 or 2. So I have mentioned it's sort of kind of a couple of postdocs and people who sort of are in between students and staff, and so it's not our main target audience, if you like, but we don't preclude anybody from joining. I think what we probably wouldn't want is a horde of sort of undergraduate students joining who are not really doing systematic reviews anyway, and I suspect would be overwhelmed by the conversations that are in there, because it's not stuff that they actually need to know anyway. So it's not that we want to exclude them particularly, it's just probably that it's not really their thing, I would think.
I'd also say we don't cover the stages really beyond. I mean, we have some discussions about the inclusion-exclusion phase and the tools that you might use around that, but we're not actually looking at later parts of the whole systematic review process from start to finish. So we don't necessarily have conversations happening about doing the meta-analysis and other things that come at later stages. So the content is very much focused on what information specialists do best, which is our wheelhouse in really structured, thorough searching, making sure that the documentation is transparent, that the searches are reproducible, and all of the different kind of little things that are probably really boring for other people, but that get a lot of us quite excited. I know sometimes I feel like I don't realize I'm the odd one out when I'm really getting nerdy about the fact that I've fixed something for Web of Science that I couldn't work out what was broken. So it's nice to have a room full of other people, even virtually, who can get as excited about the minutia of searching and this particular method.
Yeah, the appreciation
Absolutely.
of the hard work is good. I just like the comment that's in the chat at the minute. It sometimes starts pinging and makes me wonder what useful essay webinar I'm missing out on. So I do like that. It's, we get a bit of FOMO maybe. I am going to come back to the live events because I'm just wondering if anyone would like to see anything on the Discord for live events, if Kathryn or Erin have got any kind of ideas, but I'm not going to put you on the spot right now. You can have a little minute and think about that one. There's another question in. So do you feel that there's a minimum community size to have the benefits that you're describing? We're tentatively trying to do something similar, but wonder if we're being too niche to reach that tipping point number. So do you think there's a minimum size that we need for the Discord?
I think it's hard to know because we were extremely fortunate that because there was such a desire for it that we added a lot of members very quickly. So that first 100 odd came within the first month. I suppose it depends really how committed people are to the topic of that server and how active they're willing to be and how much time they have willing to be active. We seem to do quite well when we had 100. We seem to do well now when we've got sort of 200. And a quick look shows me that 20 people have joined during the course of this session. So we're suddenly bigger again. I do think that the way that you interact with Discord and the choices that you have and the way that you structure it does mean that people can be quite choosy about which bits they choose to engage with and which bits they choose to answer. So I suppose I personally don't think there is. I think it's more about making sure that you are doing what your users want in that server and what they find helpful more than how many of you there are.
I'd have to say I agree with that. And I know that we have had some kind of anecdotal comments from people at different institutions who've said, oh, well, we do have something like this, or we've got a wiki, or we've got a Teams site internally, but it's just not as active because by nature, there aren't as many people at our institution doing this thing. So I think if you do have quite a heavy, strong focus, or if you've got access to kind of satellite or affiliated institutions that you could broaden out to, that would probably help kind of maintain a level of activity. But I think particularly for, as we've said, for a lot of us who are very much on our own or this is our little niche where we're in, it's really helpful to have that broader access to people in a whole range of different kinds of institutions.
Yeah, I agree with that. It's how you use it rather than the number, I think. So my question, and I've got a couple, when people introduce themselves, and I think that's perhaps the only way you may know the answer, but I could be wrong. Do you get a sense of why people are joining? Do you get a sense of why, what they want out of the platform, or do people not tell us? Have you got a sense of why people are using it?
I would say it's a bit of a mixture, really. We definitely see a lot of people who come in and who kind of hold their hands up and say, I'm right at the beginning. I've literally just moved disciplines and I'm all of a sudden being asked to help with this kind of methodology and I'm feeling really out of my depth and I need some help. And obviously that is exactly, we want to be a safe space for that. And many of us have felt like that at previous points in our careers. I do think there's also a facet of people who have more experience who've joined because potentially they may have lost access to other communities of practice or they just prefer to engage in the way that Discord allows. I know there are sort of different avenues for different people, and some people may much prefer email lists rather than something like Discord. But for the people who join and who do comment on what they're getting out of it, it definitely seems to be both a actual active asking of questions and getting answers and having those peer-to-peer discussions, as well as just a information gathering and an educational aspect where they're just there to try and learn as quickly as possible so they can get themselves up to speed in and apply things in a broad sense. I know that if you're supporting education, for example, you might not necessarily be looking at all of the Cochrane guidance. You might be looking over maybe at Campbell guidance. So there are like different shifts that people might be making if they're in different disciplines or serving different communities.
Yeah. Okay. Thank you. Anything to add, Kathryn?
No, absolutely. Just going to say, completely agree with what Erin said there.
So there's a question about not the choice of Discord, but how for some people it might not be quite as user friendly as perhaps we're anticipating. So I'm just going to go down to the actual. So it says unless the conversations. So let me go. For me, the problem is the text channels are broad in nature, and there can be several conversations going on at the same time. Now, unless these are happening in real time, they can become quite fragmented, making them difficult to follow. So the question is, wouldn't a traditional forum provide a better separation between conversations with each channel? What's your thoughts on that?
I would agree to an extent. It can get a bit fragmented. I mean, I have seen another server. I've got a colleague who showed me their gaming server that has a huge number of channels on. Now, personally, I found that a little bit confusing because there were so many channels. I felt like I would have probably spent half my day trying to work out which one to post in. But at the same time, I totally take the point, because actually you sometimes look at them and think maybe we do need more of them. And I suppose that that's part of the feedback that we take is, do we need to have more? Do we need to separate it out a bit? Do we separate it out? If we separate it out too much, do people start worrying about whether they're posting in the right place, or not? I'm not. I think also we have. We're all getting to grips with Discord as well. None of us had used it really before we started this, and there are ways to thread conversations in Discord that we perhaps haven't really made full use of yet. So I think Discord probably has functionality that I've made a few notes on that haven't really kind of properly engaged with yet. And I think as it grows, you're absolutely right that we will probably need to get a grip on that a little bit more. And perhaps we will need to add some more channels and possibly even write some guidance about which channel is the best place to post which query. We went into it with a very much a kind of, we don't want to be prescriptive in any way kind of approach. But the nice thing about Discord is that we have the option to become more prescriptive if we feel it's necessary, which was one of the selling points for it for us.
Anything to add, Erin?
Nope, absolutely agree. There are definitely some functionalities that we've been looking at that are kind of on our summer to-do list, you know, the mythical summer when things slow down and you can take a little bit of time to work on extra projects. They're on the summer to-do list for us to implement and think about how we might be able to structure things, or are particular types of channels actually better suited to exactly that more really kind of very visible forum structure. And there are some other Discord servers. There's a brilliant one that serves, that's medical librarians dedicated, that was started in the US, that has some really lovely structures. And we don't have the same volume of topics that are there, but there are definitely some things that we've seen or that members in both servers have pointed out that we've gone, oh, maybe we should think about evolving the way that we structure ourselves to make it more broadly friendly for folks who are finding difficulty navigating.
Yeah, and I'm just looking at some of the comments in the chat. So there's a comment about how they like that they can go and look for updates or ask questions on notifications, because all of the channels pinging Teams email lists, JISC lists can get too much. Someone's put the threads are brilliant. Now someone's put can recommend threads. Not sure if they expire after a certain amount of time. I don't think they do, but like Kathryn and Erin, they don't
I think
expire.
they close if nothing. If you don't post within 7 days, something like 7 days that they close. I don't think they don't disappear in terms of the content, but the thread as a conversation. It's like, oh, no one's talking in this conversation anymore. This conversation is over, which I guess makes sense really in a way, because once that sort of period of time has expired, perhaps you want really to have a fresh conversation at that point.
And then there's a comment, some other servers that I'm on have rules and tips type channels. Is that something that you would introduce? Is that something that you've thought about?
Yeah, I would say so. I mean, we have the kind of announcements and housekeeping channel now that's relatively new and at the moment hasn't got a great deal in it. But I think, yes, if we feel the need to that we need to get a bit more of a bit more rule orientated or a bit more guidance. We'll call it guidance rather than rules.
Yeah.
That's something we can certainly look at doing.
Yeah, I think I remember very vaguely Kathryn sending me how to use Discord video because I was like, what? So I think I very vaguely remember that, and it was quite an easy video to watch, wasn't it? From what I remember.
It's still pinned, I think, in the. I think that's the thing that's in the housekeeping channel. I think actually is that video.
Yeah, okay. So then I'm going to do this one as the last one. And this one's more about creating a COP for students. So just let me go back to the bottom. If the COP is an appropriate space for students and researchers, wonder if anyone has given thought to creating a similar platform that would be more student orientated. And this is going back to the old adage that we're all getting more and more systematic review queries and the capacity. So it's just something that I'm putting out there, really. I mean, you can answer it if you like, if you think it's something that you would think was appropriate or.
I think this is a really interesting suggestion, and it's something that I've kind of had little thoughts about. But I think the difficulty for that is that when you create a space like that, there has to be someone who's part of their role is dedicated to maintaining and monitoring, especially when students are involved. And I almost think that a community like that would be a really good kind of student library partnership project where you might have some master students or some early like first or second year PhDs in relevant disciplines who could come in and help support the queries that are coming from students who are doing, shall we say, systematized reviews instead of the whole systematic review, because is a lot of nuance to those one-to-one meetings that have been mentioned in that comment. And I know that from my perspective, as one person who's had to put a cap on the number of one-to-ones that I can do with PhDs, they need resources, but they also need confidence building. And I think a peer-to-peer space, as long as there was enough not expert, but like the next layer level of understanding available in that peer-to-peer space that could help with the confidence building. But that being said, wouldn't it be brilliant if all of our institutions could create roles that would allow for specialist teaching in this area, since we see a demand? So hopefully we will see more posts like a few that exist at different institutions cropping up to help facilitate and meet that need and take the pressure off of one person and spread it around a little bit more.
Yeah, I think I would echo all of that, Erin. And I think as well, it's also, I mean, I deal a lot with undergraduate students, and what they're calling systematic reviews are nothing like in a lot of ways. And the way that a lot of their supervisors interpret all of that can be different. So we also have that, what is actually in their assessment brief and what will they tell us is in their assessment brief can be quite different things. And that would be my concern on a quite open platform. They already have WhatsApp groups where they thoroughly mislead each other into believing all sorts of nonsense. I suppose if someone has the time, as you say, to sort of moderate it, look at it, see what's going on, but it's quite a task for somebody. It's not something I would be able to manage if I had a Worcester one like that. There's no way I could possibly manage it in my current workload and never let anything dubious slip through the net. I'm absolutely certain of it, unless I had such strict control of it that I was actually approving every post, and then that kills the conversation dead if I'm busy for a day or two. So I love the idea but in practice I see lots of pitfalls. That sounds very negative, but it's not intended to be. It's more pragmatic, I suppose, based on what we know is we've got in terms of time and facility to do this kind of thing. It's a lovely idea, though.
I can say that here at Lancaster we have a Teams channel. That's a systematic review Teams channel that ideally is peer-to-peer, and we do monitor it because sometimes we're the only ones that will answer the questions in there. But it has got a bit of traction. It has got a bit of traction, and we don't. I don't monitor it. There's no rules or regulations or anything like that on it. But I get the notifications if there's any questions in there. And I have to say, some people will share the search strategy and they'll get their peers to have a look at it and see what they think. The most recent one was something about EndNote, and then someone else had messaged and said, have you tried this? So it can work, but ours is just institute only, so it's just for Lancaster, and it is something that we have got. So maybe that's something that you could perhaps have a look at. And just as a last comment on here, it's funny how we all struggle to name reviews based on systematic principles, but done by source researchers and therefore not fully systematic. Oh, there's so many conversations. Recently, I made the conscious decision to settle for semi-systematic review. And then someone else has said systematic-ish, which makes me laugh. Great session. Systematic adjacent. That's also one. Oh, someone's put they've got a Teams channel for people at their institute as well. It seems to help people to know that they can answer questions if they need to. So it could be something that people could look into. And I think that is all the questions. I think that's all we've got time for anyway. I want to say thank you to Erin and these time channels at Lancaster open to students or just staff. Here at Lancaster, they're open to students, staff and researchers. They're open to everyone. So I can say that. So I want to say thank you to Kathryn and Erin. And thank you to everyone on the call. We can't do these without you. I say that every single time. Without you, there will be no conversation. Sophie has just put a feedback form in the chat, so I'd really appreciate if you could have a look at that. And again, it's something that I can work on, and we can work on it for next year's programme. But thank you, everyone. I will send the recording out as soon as I can, and it's great to see you till next time.